do a YouTube channel, so I wanted to record this if you don't mind, and I can blur you out.
Okay. Do you have your photo ID?
Yes. Got it. Do you need me to wear a mask?
That's up to you. I'm okay.
The mask is mostly protects the other person, so
Right.
we isolate. So there's my ID.
And your social security number. Do you use any form of nicotine or tobacco products?
Nope.
Any personal history of diabetes?
Nope.
Heart disease?
Nope.
High blood pressure?
Nope.
Cancer?
No.
And in the past 5 years, have you had more than 2 moving violations?
No.
And when is the last time you had anything to eat or drink other than water or black coffee?
Too long. Last night at dinner, so it's been...
Oh, it's been a while.
Probably 6 o'clock or so, 6 or 7.
Okay. And do you take any prescription medication?
No. I think I lost a pound since last night, since I don't have any food in me. I'm ready to eat, though.
I bet. Do you have a primary care physician?
Sort of. I think I have a care office.
Okay.
But the doctor changes.
Okay. And do you know approximately the last time you were seen there? Do you recall what type of appointment that would have been for?
That would have just been
a routine physical?
Yeah.
Normal results, no treatment prescribed.
Right.
And is your primary care physician's office the last physician that you have seen?
Yes.
In the last year, have you lost more than 10 pounds?
Nope.
And in the last 10 years, have you ever been diagnosed with or treated for any of the following? Any cancer or tumor?
Nope.
High blood pressure, a heart murmur, irregular heartbeat, palpitations, heart attack, coronary artery disease, chest pain, or any other disease or disorder of the heart, blood vessels, or circulatory system?
No.
High blood sugar, high cholesterol, diabetes, a thyroid disorder, or any disease or disorder of the blood?
Nope.
Any disease or disorder of the kidney, bladder, or urinary system, including protein or blood in the urine?
Nope.
Any disease or disorder of the prostate, reproductive system, or genital organs?
No.
Crohn's disease or colitis, blood in the stool, hepatitis, or any disease or disorder of the liver, colon, pancreas, spleen, stomach, intestines, esophagus, rectum, gallbladder, or any hernia or surgery for weight loss? Arthritis, chronic pain, autoimmune or connective tissue disorder, multiple sclerosis, Parkinson's disease, or tremors?
Nope.
Any disease or disorder or condition of the back, spine, spinal cord, joints, limbs, or bones?
Just old age. No.
Yeah. We all have problems with those. Asthma, emphysema, chronic obstructive pulmonary disease, shortness of breath, any disease or disorder of the lungs or respiratory system?
Nope.
Allergies, or any sleep disorder, including sleep apnea?
Generally, no. I tend to get a little bit of allergies.
Like a seasonal kind of allergy?
Yeah, seasonal allergy. I don't know what it's to, though.
Okay.
Like pollen, most likely.
Any seizure disorder, stroke, transient ischemic attack, memory loss, Alzheimer's disease, dizziness, headaches, or any disease or disorder of the brain?
Nope.
Any disease or disorder of the eyes, vision, ears, hearing, nose, or throat?
Nope.
Anxiety, depression, stress, attention deficit disorder, post-traumatic stress disorder, or any other mental, nervous, eating, or emotional disorder?
No.
Chronic fatigue syndrome, fibromyalgia, neuritis, neuralgia, narcolepsy, insomnia, restless leg syndrome, Epstein Barr virus, Lyme disease, muscle weakness, or any disease or disorder of the muscles, nerves, or nervous system?
No.
Have you ever had an amputation of any kind or physical deformity, handicap, or impairment that has been diagnosed by a member of the medical profession?
No.
And within the last 10 years, have you received any speech, physical, or occupational therapy?
Nope.
In the last 10 years, have you tested positive or been diagnosed by or received treatment from a member of the medical profession for acquired immune deficiency syndrome, AIDS-related complex, or human immunodeficiency virus?
No.
You are not currently taking any prescription medication, and you have not been prescribed any medication within the last 6 months?
Correct.
Are you currently taking any non-prescription medication or supplements?
No.
And describe your complete use of tobacco
No.
or nicotine
Never.
history. Never used. Describe your complete use of alcohol below.
Never.
And describe your use of marijuana in any form in the last 5 years.
Never.
In the last 10 years, have you used or are you using stimulants, cocaine, heroin, morphine, hallucinogens, methamphetamines, narcotics, opioids, or any other illicit drug or controlled substance except as prescribed by a medical professional?
No.
Have you in the last 10 years been advised to have counseling or treatment for alcohol or drug use?
Nope.
Are you currently receiving or within the last 5 years have you had any sickness, injury, or other condition in which you received or applied for any disability benefits, including workers' compensation, Social Security disability insurance, or any other form of disability insurance?
No.
Within the last 5 years, have you had a physical exam, checkup of any kind, or diagnostic testing? And as far as physical exams or checkups go, you had one in 2017, but we've already documented that. Any other checkups or
I don't
physical
think so.
exams within the last 5 years? And so in the last 5 years, no surgery or diagnostic testing. Do you have any scheduled appointments within the next 6 months to seek medical attention?
Nope.
And other than previously stated on the application, are you currently or in the past 5 years have you received medical advice, counseling, or treatment for any medical, surgical, psychological, or psychiatric condition from a medical professional, or have you been a patient in a hospital, clinic, rehabilitation center, or other medical facility?
No, that 5 years, right?
Right.
Yeah, no, I don't think so.
And to the best of your knowledge, has any immediate family members, so just parents or siblings only, died before the age of 60 from cardiovascular disease or cancer?
Nope, they're still alive.
All right. And to the best of your knowledge, has any of your immediate family members been diagnosed by a member of the medical profession for before the age of 60 with cardiovascular disease or cancer?
No.
And has any immediate family member ever been diagnosed or treated for diabetes, mental illness, or any hereditary condition of the brain, muscles, nervous system, eyes, or kidneys?
My dad right now, I think he's in pre-diabetic,
Okay.
but he's like 70.
That's my next question. How old is your father?
Okay, so let's see. I think he was born in 44. So 76.
And your mother?
She was born in 50, so 70.
And do you have any living siblings?
Yes, I have a sister and a brother.
And
Older sister, she's
any deceased siblings?
nope.
Great. I just need your signature on that bottom line. And you are the ordering agent as well?
Yes.
Okay. All right. This is consent for HIV testing. In the event of an abnormal or positive result, would you like that result to be mailed directly to yourself at home or sent
Yeah.
to your primary care physician's office?
To me.
All right. So I just just need your initials there for results to be mailed directly to yourself, and then signature and date.
10th or 11th?
The 10th. And then authorization to obtain medical records. And I'll have you sign there. Step on a scale for me. Great. And I'll have you stand with your back to me. 5, 6.5. We'll go 5, 7.
About right. So now my scale is a little bit lighter.
Is it?
Yeah. Just a little bit. It was like, before I put my shirt on, 164.2 this morning.
Okay. And then I'm going to get your pulse on your wrist.
Which one? Take a pick. Don't cross my legs, right?
72. And blood pressure on the left arm. Do you usually have pretty low blood pressure? 104/66.
Yeah, I've never been in the high range, that's for sure.
And then I'm going to switch and do your right arm.
Okay.
– 100/62.
Is that even lower?
Yep.
That's like normal range though, right? Just
Yeah, it's definitely on the low end.
okay.
But you're okay.
Okay. Yeah, I've always been in the low range when you go to the store and do it at those things.
And then I'm going to have you stand. Put your arms out to the side for me. And then I'm going to have you blow out all of your breath and deflate your chest as small as possible.
Arms out still?
Yeah.
It's the first time I've seen that one happen. I didn't do that with my last one, but that was a couple years ago. What's that measurement for?
Hang on 1 second.
Okay.
I'm gonna have
Did
to
I make you forget the numbers? Sorry.
I know the range that it was in, but I knew you had a 4-inch expansion, but I can't remember where we started.
No worries.
Okay, blow out all your breath and deflate as small as possible. I'm already remembering now. And then inflate as big as you can. Perfect. That is lung capacity.
Oh. Okay. Yeah, they definitely didn't measure lung capacity. But I did in my last.
Yeah,
insurance
not
medical.
all insurances do it. It's kind of a little bit of an archaic kind of testing method or measurement that's not used much anymore.
Yeah. Maybe bringing it back with COVID.
Right? And then I'm just going to get one more blood pressure. Before I do that, I'll have you initial next to the height and weight that we got today. And a signature at the X. And I'm going to go back to the left arm. And right in the middle, 102/64. All right. So all that we have left is blood and urine, and we are finished. I think I might not grabbed your kit out of the car, so I'm gonna have to run and grab that real quick.
Okay. I wasn't saving up anyway, so probably every few minutes will help, or every few seconds.
Do you have a preference which arm I draw from?
Left one's fine.
Okay.
I should have said, yeah, yours.
No.
It's like this TikTok I saw where the lady says, I didn't realize when your kids ask you what child is your favorite, that it has to be one of your own.
That's funny. One last signature from you on this little yellow sticker that's going to seal up your urine sample and keep it tamper-proof.
Last time I had this done, I didn't even feel it. So the bar's set pretty high for you.
I did it the last time.
You were here?
I was here. I did it.
Okay.
You and your wife.
Okay. Well, good.
Well, so, I mean, there's still a bar to reach, obviously.
Yeah.
So.
You said it yourself, though. That's good. It's been a couple of years, so.
All right, just a quick poke.
Nothing to it.
And go ahead and press on that.
So has business really slowed down with the...
It did for a while, and now it's very busy.
Okay, that's good. I know there's that other medical exam provider place that just went out of business all of a sudden.
I had an agent send me a message and ask me about that, and I wasn't sure what he was talking about. I assumed that it was another company here in town, and he said they just closed their doors.
EMSI?
Yeah.
EMSI, yeah. I don't know where they're located, but...
And apparently that's who he ordered all of his things through, and so he was checking to see if I was still doing exams. So.
Oh, good. I hadn't used them, so... But I figured, they went out of business basically because they didn't have enough to keep them going. So glad to see it didn't affect you.
Nope, it did not. All right, all that we have left is just a little bit of urine. I don't need much. I just need enough to come up above that temperature strip.
Okay, I will try.
All right.
Usually good at tests.
Okay.
See, I'm an overachiever.
All right. And I will let you discard that.
You don't want that either?
I do not, but thank you.
Didn't figure.
All right.
That's it.
That is everything.
Okay. Did I pass?
I mean,
No,
you definitely made it within normal range on everything, but other than that, I don't know.
Well, thank you, and hope to see you again next time I look for some life insurance.
All right. Well, thank you very much, and you have a great weekend.
Stay safe out there.
Oh, I'm trying. All right. Thank you. Bye-bye.
All right. Have a good one. That's it for the life insurance medical exam. So now you know what you can expect if you have to get one as well. That was very similar to a previous medical exam that I had for life insurance. The difference being the chest expansion test, we didn't do that one. So there is some variations, actually the chest expansion and around the belly measurement. So those are two new ones that I did not have at the last medical exam that I did. So slight differences depending on which company you're using, but hopefully this helps. And feel free to check out some of my other videos right over here. Now go maximize your cash flow.